So we just learned about atropine and how atropine is used to treat symptomatic bradycardia, specifically symptomatic sinus bradycardia. Another drug that we can consider, you've done a lot of drug calculations with already, but you haven't really talked much about it, and that's dopamine. Dopamine, by classification, is an inotropic agent. And dopamine, the chemical dopamine in the body, is a precursor to the chemical of norepinephrine. There are several different subtypes of dopamine receptors, and we're not going to get into all of that today, but we are going to look at the basis of dopamine. So I said dopamine is an inotropic agent. However, it also has properties of chronotropy, and that of vasoconstriction. Dopamine is a unique drug because the effect that we're going to elicit with its use is really dependent on your dose. We normally classify dopamine into low doses, medial doses, or high doses. At really low doses, and all of the dosage ranges are kind of subjective, but I'll say less than 2 micrograms per kilogram per minute. And it depends on who you ask, if it's 2, if it's 5, if it's somewhere in between. But low doses are renal doses. So these cause renal artery dilation and increased blood flow to the kidneys. In the pre-hospital setting, we don't use dopamine for this, so we don't ever give less than 2. So 2 is our starting dose. I'll just tell you off the bat, our dose is 2 to 20 micrograms per kilogram per minute. So in our lower range, meaning that we're somewhere between maybe 2 to, again, I'm making up numbers, to 10 micrograms per kilogram per minute. Very subjective, just coming up with some numbers to say it's the low end. On the low end, the primary effect of dopamine is going to be on the heart rate. So you're going to have a positive chronotropic value on the lower end of dopamine, primarily. These are the primary responses. When we get into a medial dose, so somewhere between maybe 10 and 15 micrograms per kilogram per minute, it acts more as an inotropic agent. We have positive inotropy, meaning that it's going to increase the strength of cardiac contraction. At high doses, greater than 15 mics per kg per minute, the primary effect is that of vasoconstriction. Now, it is important to note that you get some of each of these at all of these doses, okay? But at the low dose, the primary effect is on the heart rate. At the medial dose, the primary effect is on the strength of cardiac contraction. And at high doses, the primary effect is that of vasoconstriction. So I can kind of tailor my dopamine infusion to meet the needs of the patient. So dopamine is a really neat drug. Remember that the formula for your dopamine drip is your dose times your patient's weight in kilograms times your drop set divided by your true concentration. Dose times weight times drop set divided by your true concentration. And that is the basics of dopamine.